Is dysthymia different from depression? Key differences explained. Dysthymia, now known as Persistent Depressive Disorder, PDD, and Major Depressive Disorder, MDD, are both types of depression, but they are distinct in their duration, severity, and impact on a person's life. While both conditions involve symptoms of sadness, hopelessness, and a lack of interest in activities, the key differences between dysthymia and major depression lie in their duration, intensity, and how they affect daily functioning. Understanding these differences is crucial for accurate diagnosis and appropriate treatment. In this article, we will explore the key differences between dysthymia and depression, focusing on their symptoms, duration, impact on daily life, and treatment options. 1. Duration of symptoms. One of the primary differences between dysthymia and major depression is the length of time the symptoms last. Dysthymia, persistent depressive disorder. Symptoms of dysthymia must persist for at least 2 years, 1 year in children and adolescents. The depressive feelings are chronic and long-lasting, often low-grade, but pervasive throughout daily life. People with dysthymia may not feel completely normal for years at a time, making it a constant struggle. Major depression, MDD. The symptoms of major depression must last for at least 2 weeks, but the disorder typically does not persist as long as dysthymia. MDD can appear suddenly and intensely, with periods of severe depressive episodes that may last for months. The individual may experience complete emotional shutdown, often feeling deep despair, and may be unable to function in many aspects of life. Key insight: dysthymia is a chronic condition, while major depression is often characterized by episodic, more intense depressive episodes. 2. Severity of symptoms. While both conditions involve sadness and emotional distress, the severity of the symptoms varies significantly between dysthymia and major depression. Dysthymia, the symptoms are typically milder but are constant and affect the individual's mood on a daily basis. Individuals with dysthymia may feel slightly depressed or sad for long periods, without the extreme emotional lows that characterize major depression. Although they may still function in daily life, their overall mood is persistently low. Major depression. The symptoms of major depression are more severe and can cause significant impairment in daily functioning. Individuals with MDD experience intense emotional pain, including extreme sadness, lack of interest in activities, hopelessness, guilt, and irritability. In some cases, it may be so severe that it causes people to withdraw completely from social activities and work, making even simple tasks like getting out of bed extremely difficult. Key insight: dysthymia often involves persistent, low-grade sadness, while major depression is typically characterized by more intense and debilitating symptoms. 3. Impact on daily life. Both dysthymia and major depression affect a person's ability to function, but their impact on daily life is different. Dysthymia, because the symptoms are more chronic and less severe, individuals with dysthymia may still be able to function to some extent in their personal and professional lives. However, their low mood and lack of motivation often make them feel disengaged or dissatisfied with life. It can be a long-term struggle, as the person may feel stuck in a cycle of low mood without any significant improvement. People with dysthymia may still maintain relationships and hold jobs, but often feel numb or emotionally distant from others. Major depression. Major depression can severely impair a person's ability to function in daily life. The overwhelming sadness, lack of energy, and feelings of hopelessness can cause significant difficulty with work, social interactions, and basic self-care. Individuals may struggle to perform everyday tasks, like showering, eating, or getting out of bed, and may withdraw completely from friends, family, and activities. In severe cases, major depression can lead to suicidal thoughts or attempts, which require immediate attention. Key insight: dysthymia may result in a chronic feeling of low energy but often allows for continued functioning, while major depression can lead to severe impairments in everyday life and significant isolation. 4. Risk of recurrence. Both dysthymia and major depression can recur, but the risk of recurrence and the likelihood of experiencing a second episode differ between the two. Dysthymia. Individuals with dysthymia are at a higher risk of developing major depressive disorder later in life. This is because chronic low-grade depression can eventually intensify into a full-blown depressive episode. Those with dysthymia are also more likely to experience long-term struggles with mood, even if they do not experience a major depressive episode. Major depression. People who have had one episode of major depression are at a high risk of recurrence. Without proper treatment, major depressive episodes may come back, and they can become more severe over time. The recurrence risk is especially high in individuals who do not seek therapy or medication. Key insight: dysthymia may develop into major depression over time, while major depression often has a high recurrence rate, especially without treatment. 5. Treatment approaches. The treatment for both dysthymia and major depression involves a combination of psychotherapy, medications, and lifestyle changes. However, the approach may vary slightly depending on the severity and duration of the symptoms. Dysthymia. Treatment for dysthymia often focuses on long-term therapy and may involve cognitive behavioral therapy, CBT, which helps individuals identify and change negative thinking patterns that contribute to low mood. Antidepressant medications, such as SSRIs or SNRIs, are often used to regulate serotonin and norepinephrine levels in the brain. Since dysthymia is a chronic condition, ongoing therapy may be necessary to help individuals manage symptoms effectively over time. Major depression. Treatment for major depression often involves intensive therapy to address the emotional and psychological roots of the condition, alongside medications to regulate mood. CBT and interpersonal therapy, IPT, are commonly used to help individuals understand their emotions, challenge negative thinking, and improve interpersonal relationships. For more severe cases, hospitalization or intensive outpatient programs may be necessary to ensure safety and support during the recovery process. Key insight: both dysthymia and major depression benefit from therapy and medication, but major depression may require more immediate or intensive treatment, especially in severe cases. Conclusion: while both dysthymia and major depressive disorder, MDD, are forms of depression, they differ significantly in their duration, severity, and impact on daily life. Dysthymia is a chronic, long-lasting form of depression with less severe symptoms, but it can still affect emotional well-being and daily functioning. Major depression, on the other hand, tends to have more intense symptoms that significantly impair one's ability to function and may lead to greater emotional distress. Understanding these differences is crucial in diagnosing and treating depression effectively. Both conditions are treatable with therapy, medication, and lifestyle changes, and seeking professional help is essential for managing the symptoms and improving overall quality of life.